Let's be honest, pooping is a part of life, but for many people it is not always easy. If you deal with constipation, straining, incomplete emptying, or pelvic floor symptoms, the way you poop might be making things worse, or a whole lot better. Today, I'm breaking down exactly how to support your pelvic floor so you can have smoother, healthier bowel movements. Hi, I'm Dr. Brooke Kalisiak, a pelvic physical therapist and owner of Legacy Physical Therapy in St. Louis, Missouri, and I help people improve their pelvic health so that they can feel and function their best. So let's talk about how to poop better. Yes, really. What are normal pooping habits? Before we talk strategy, let's talk about what's considered normal for our bowel movements. You should be having a soft formed bowel movement 1 to 3 times a day or 3 times a week. This can vary depending on the person and what your history of pooping has been. So we always want to kind of look at how things have worked in the past and if there's a change. But most people poop daily to every other day. You may need to push a little, but you should not be straining or holding your breath to force anything out. If you're doing something called the Valsalva maneuver, where you're bearing down as hard as you can with your breath held, that's a sign that your pelvic floor might need help. Your body should be able to eliminate poop without turning it into a full-on workout. A lot of people don't realize this, but your pelvic floor muscles play a huge role in pooping. So here is your pelvic floor, looking at it from the bottom. This is a female pelvis, and anything that's in red is muscle in the area. And specifically on the back side, we have our tailbone here, and then our anus right here. And we have our external anal sphincter around it, and a deeper layer of muscles behind that. So during our bowel movements, our pelvic floor needs to relax, open up, lengthen. What it shouldn't be doing is tightening and clenching or contracting. If it does, you're essentially trying to push through a closed door, and this can lead to straining, hemorrhoids, incomplete emptying, pelvic floor dysfunction, and constipation. So remember, our pelvic floor muscles should be able to relax, lengthen, and let go to make that bowel movement come out smoothly. Position matters when it comes to bowel movements. The way you sit on a toilet can make or break your success. So here's an idea of an ideal position for easier bowel movements. First and foremost, use a stool. You want to get your knees up above the level of the hips, because when you do that, that helps to open up the pelvic floor and make it so that things can empty out easier. My personal favorite is the Squatty Potty, but any type of small stool where you can get your feet up on it so that your knees are above your hips will work. When we're sitting, you want to think about getting your knees out wide. This opens up the pelvic floor area as well. We women tend to bring our knees in close when we're sitting on the toilet. Instead, we want to be like our male counterpart and do some man spreading here and get our knees out wide. You want to think about leaning forward from your hips, not slouching. We don't want to round our back and come down this way. We want to think about hinging forward from the hips, and you can rest your hands or your forearms on your thighs to help support the body and help activate our muscles appropriately. When we get into this right posture alone, it can decrease that need to strain and really help to make the bowel movements happen more easily. Let's talk about a few ways to create an effective push without straining. You should never strain to force the poop out. Instead, we want to use gentle, coordinated pushing strategies, and here are 2 of my favorite. One I call the pinwheel push. So remember when we were young and we had those little pinwheel spinners? You want to think about blowing through pursed lips like you're trying to blow on a pinwheel to make it spin. This helps your diaphragm and your pelvic floor move together and create natural downward pressure. Another option is to think about belly big, belly hard. Imagine that you're pushing your belly outward like you swallowed a beach ball. Let your belly expand and firm up, and this moves the pressure downward without straining and helps to keep your pelvic floor relaxed. These techniques can help you avoid that Valsalva maneuver and help protect the pelvic floor when you're having a bowel movement. Now, if you feel like you're dealing with heaviness or pressure, or you can't get the last bit of poop out, then you might want to think about ways to help support your pelvic floor when you're having a bowel movement. If you feel like stool gets stuck or you can't quite empty completely, here are two helpful tricks. One is perineal support. So you can wrap some toilet paper around your fingers and then gently coming from the front, press upward onto the perineum. This is the tissue between the vagina or the scrotum and the anus. So both men and women can do this technique. Men are just going to have to move the penis out of the way. But supporting upward here on that perineum can help support the pelvic floor and give your rectum a little extra help in positioning when you create that push to let the poop come out. Now, women can do a different technique called vaginal splinting. So if you have a vagina, you can take your thumb and insert it into the vaginal canal and push backwards towards the rectum. And this helps to support the rectal wall and can help the poop move more easily towards the anal exit. So these techniques are simple, safe, and surprisingly effective if you're feeling like you're having incomplete emptying. So I suggest trying them. So hopefully this video has showed you that pooping should not be painful, stressful, or exhausting, and your pelvic floor should be helping you, not holding you back. If you struggle with constipation, incomplete emptying, straining, or pelvic floor issues, you don't have to figure out it on your own. Pelvic physical therapy can help you retrain your muscles and learn the strategies your body needs to feel better. Reach out to us directly here at Legacy Physical Therapy to schedule either a virtual or in-person consult, and your pelvic floor will thank you. Now, don't forget to like, subscribe, and share if this video was helpful. Thank you for watching our video. We hope you found it informative. We put out weekly content on pelvic health topics because we want people to be able to optimize their pelvic health throughout their lifetime. Make sure you like and subscribe our channel so that you're alerted when our next video becomes available.